legalities around cannabis use, throughout the world, in particular in the UK, 'cause that's where we're based?
Yeah. Okay. So for the UK, let me try and make it simple. Cannabis was, in 2018, it was rescheduled by the government from Schedule 1 to Schedule 2, which meant it was recognised as from not having any medical value to having medical value. Not cannabis per se, cannabis-based medical products. So products that are produced by companies for medical use that have to fit certain criteria. They have to be approved by the MHRA, which governs medicines in the UK, predominantly brought in from overseas, and then could be prescribed. The law at the time stipulated that the initial script has to be done by a specialist, a specialist doctor, which basically excludes GPs. So it could be a pain specialist, a psychiatrist, a neurologist, even, in theory, a surgeon or someone kind of working within their own ENT or whatever could initiate a script if they kind of, if they felt that the patient fitted the right criteria. There are no kind of limits on conditions that can be prescribed for. And the process has to ideally go through an MDT, like a team decision. So the script has to be done, initiated by a specialist. It's quite tricky for that to be done within the NHS because there are issues around funding of these types of medicines. They're unlicensed medicines, which means they haven't been through large clinical trials like a lot of pharmaceutical drugs that we prescribed. However, there are lots of other unlicensed medicines that are prescribed and financed. So it's a slightly convoluted process. But what's happened over the last few years is there are a lot of clinics that exist now in the UK that prescribe medical cannabis. And a simple Google search, you'll find them. I think there's around 40, 45 clinics. So they'll often employ specialist doctors, but they'll also employ some GPs or pharmacists or nurses that prescribe under the direction of the specialists. So yeah, it's not too difficult to get a script if you kind of, I guess, fulfill the criteria. It's generally quite accessible now for patients wishing to go down that route. Although there is a cost to prescription.
Yeah, that's super interesting because, again, when we spoke earlier, I found it a bit strange how GPs, we still can't initiate a script. It's almost because we do a lot of, so it sounds like we can still do a lot of the legwork of taking the history of a patient and recommending a script, but we can't, as you said, initiate it without.
Yeah, and that's unique to the UK. So there are around 50, 60 countries where cannabis has been made legal for medical use. It's predominantly GP prescribing. The biggest markets that I know are North America, of course, Canada in particular, but Germany and Australia, there's lots and lots of GPs that are prescribing. And interestingly, even closer to home in the Channel Islands, when the law was changed in 2018, they allowed GPs to prescribe. And I think there's about 10% of the GP workforce now prescribe cannabis, medical cannabis, to patients in the Channel Islands, and about 2 to 3% of the population are receiving medical cannabis on prescription in Jersey and Guernsey. Wow. Crazy.
Because I think as a GP, I think it'd be so useful to be able to prescribe because, there's things like, like gabapentin, pregabalin, amitriptyline, all these kind of things. I kind of, as a doctor, know the chance of it working are, without increasing the dose is quite slim. And then the burden of side effects. So I've always wondered for these patients, I wish there was a way of trying something else. And we'll discuss later about why cannabis is a potentially good option, not just for pain, for many other conditions. But I think one interesting thing that I touched on earlier, which I want to go through, is how it actually works and the system, because it is actually a whole system, that it's almost like completely left out of medical school almost, and training as a junior doctor in GP training. I even did some surgical training, and it was all it was never even a thing. It didn't come with any exams. But it's like, like the thyroid system or, any respiratory system, any other system, it is a thing, right?
Oh, it is a thing.
So if you talk a bit about how it works and the whole system, that would be fantastic.
Yeah, so like this, if I go back a step, when I said I got interested in this, it was because what I realised quite quickly was it was underpinned by science and evidence. It's not just a kind of pseudoscience or a fad. Like it's actually, there are real mechanisms going on underpin this. So essentially the cannabis plant has hundreds of active compounds. And what's unique about cannabis is it actually interacts with our own endocannabinoid system. So I'll just kind of try and summarize briefly the endocannabinoid system. You're right, it's largely not taught at medical school. There are a few now that are kind of rolling it out in their curriculum, but for some unknown reason, it's just not been covered in teaching, despite the fact it was discovered in the 1980s. So it's been around a while. So the endocannabinoid system is not just found in humans, it's found in all vertebrates. It's found across both central and peripheral systems, which basically means it's kind of found throughout the body. It's in the brain and the spine, but it's also in all of our organs. And it's involved with pretty much anything you can think of. The endocannabinoid system will be playing out somewhere within that. So it's found, in our... how can I put it? So let's think of a few examples. Thermoregulation, kind of maintaining our heat balance, energy in our energy stores, in the way we feel pain, in the way, our sleep receptors, our reproductive systems, you name it, you'll pretty much find it playing out in these things. And that's because we have receptors throughout the body that are our endocannabinoid receptors. And a sort of simple way of thinking about them is that they sort of fine tune all the other systems. So they can kind of put the brakes on, if someone's feeling overly anxious or the pain receptors are firing, the endocannabinoid system sort of feeds back in a negative way and can fine tune and dampen down those systems. So it's ubiquitous to life, really. I mean, it's just an ancient evolutionary system that's ticking over in all of us. And we've discovered, scientists have discovered the receptors and the way they work. There's still a lot they don't understand about it, but there's a huge number of papers. I mean, if you just type in to PubMed endocannabinoid system, it's just endless, right? So we know it exists. We also know a lot about our own endogenous endocannabinoids. So we all produce our own sort of cannabis-like endocannabinoids. So there's two that are well known. One's called anandamide and one's called 2-AG. Anandamide's actually named after joy or bliss in Sanskrit because it gives you that kind of feeling. It's associated with like a runner's high or endorphin release. You get this kind of higher level of anandamide. And anandamide's actually really interesting because there's been a couple of case studies where patients who have unusually high levels of anandamide don't perceive or feel pain in the same way that you and I would. It's a real thing. So there was a famous case in London a few years ago where this woman, and you can look this up, she was called Jo Cameron, had a very unusual relationship with pain. I think she had a car accident or surgery, and she basically didn't need any painkillers. And they found that there's an enzyme that would normally degrade anandamide that was faulty. The gene for it was faulty, so she had very high levels of anandamide, and she didn't feel pain in the same way that we do. And I think her son has the same condition. So there's like this genetic cause. So we all produce these natural cannabinoids, the endocannabinoids. And what's unique about cannabis is the phytocannabinoids, which are the active components of the plant that are produced in the flowering female part of the cannabis plant. They can interact directly with our endocannabinoid receptors, and they can modulate and affect all those systems. So they can affect the pain pathways, our mood, our sleep, our appetite, you name it. They generally can have an effect somewhere. There's two main receptors, CB1 and CB2 receptors, but there are a few others as well that have been discovered. And that's why I think cannabis is really unique, because it kind of, unlike a traditional something like you mentioned opioids or gabapentinoids, okay, some of these medicines that we prescribe for things like pain or for mood, they'll often just target one receptor. A cannabis-based medicine, and if it's derived from the whole plant, it will have hundreds of active compounds that will just kind of target lots of different receptors across those systems. So it's a much sort of broader range of action, and perhaps the effects are slightly more subtle, but they it can work very, very well for lots of different conditions.
I just want to touch briefly on, because with any kind of, just a bit of neuroscience, is that you have at the end of a neuron you have a presynaptic and a postsynaptic membrane, and generally what tends to happen is whatever is stimulating the neuron, so whether it be you want to move or whether it's an emotion, the presynaptic membrane releases the neurotransmitter, and that goes to the postsynaptic membrane, and and that gives you the response. But interestingly, with the cannabinoid system, the neurotransmitter is released postsynaptically, and then is that correct? And it goes to
the endocannabinoids are released postsynaptically, and they feed back to the presynaptic membrane and can basically tone down that the firing of the neuron.
Oh, that's interesting.
To the neurotransmitter. So it's almost like a modulating system, it's like a homeostatic system that fine tunes all of our systems, really, our emotions or our pain, or everything really that makes us alive and living. They're playing a role in that. It's why it's remarkable why it's not really taught at medical school. Whether it's related to the stigma of cannabis, I don't know. But even if you took the plant out of it and cannabis out of this conversation, it's a physiological system that is just so important.
Yeah, I I agree. Because going back to that example of the lady you said who had, excess neurotransmitter
and anandamide.
Anandamide. Yeah. So essentially, what that was doing, she had a higher amount of anandamide, which was kind of almost dampening down the presynaptic pain threshold. Is that correct? So therefore,
kind of, yeah.
Because that means if that works across so many different systems, so pain, mood, sleep, sexual function, all these kind of things, it sounds like it can work in the opposite way as well, potentially. So you can dampen down, for example, pain, but can it make pain worse or anxiety worse? Or
so I'll tell you, there's a few kind of things to discuss here. Again, like a lot of it's tricky, right? Because a lot of this is kind of hypothetical, animal studies, and we don't have really hard, robust science for this. But there is a theory called clinical endocannabinoid deficiency. I think that's the term for it. And this is a theory that's kind of been put out by some of the quite prominent names in cannabis and science and sort of biochemistry, that some people have a sort of a low kind of endocannabinoid tone. So we've all got this kind of system that's sort of ticking along underneath that keeps our kind of equilibrium. Some people, for whatever reason, have a sort of low endocannabinoid tone. And how can we kind of correlate this into the real world? So there are certain conditions that we know commonly overlap, and it can be very hard to diagnose and treat. Those being, as an example, would be things like fibromyalgia, where people have sort of perhaps more sensitive to pain, lower pain thresholds. So it's like central sensitization. It's a type of a lower threshold to perceive pain. Irritable bowel syndrome, migraine sufferers. So they're suffering often with conditions that are subjective. It's their perceived levels of pain and functioning. We don't really have any clear tests for some of these conditions. We don't have diagnostic tools or tests. The treatments are often a bit hit and miss. You mentioned some of the medications earlier, but often we're throwing things at these conditions that don't work, or they come with other side effects, particularly pain medications. And it's important to realize a lot of those medicines are prescribed off their original license. They've not gone through trials for necessarily for fibromyalgia. So we're kind of already kind of bending the rules a bit for some of these things. But anyway, there have been some studies that have looked at these conditions and theorized that maybe there's low levels of endocannabinoids. So there were a couple of studies that looked at migraine sufferers, and they found that the levels of anandamide were quite low. Similar with PTSD, I think they looked at the hypothalamus and found low endocannabinoid. Really? I need to look into it, but there are some kind of theories out there that some of these conditions, and some that particularly overlapping things like fibromyalgia, chronic fatigue, IBS, irritable bowel syndrome, migraines, that there potentially is a sort of low endocannabinoid tone. That's the reason often when you prescribe a cannabis-based product, some of these patients do really well, and they find their pain's a bit better, they're sleeping a bit better, they're functioning a little bit better. Obviously, super early days, like there's lots more kind of research to be done, but to me, it seems like quite a valid theory, because anecdotally, like a lot of conditions do improve with medical cannabis that may not improve with other medicines that are just targeting one receptor.
Yeah, I mean, just pure from just a theory point of view, now we kind of know how the endocannabinoid system works. And so hypothetically, so the cannabinoid deficiency could almost be like an umbrella term for these kind of diagnosis of exclusions, which we kind of have now, like IBS, fibromyalgia, theory. But because it makes sense, because if these are all almost conditions where your pain is almost heightened because of abnormal sensation, if this system is one that kind of dampens that down, and if you've got deficiency in that, it can't almost make sense,
top it up.
Yeah, and if you don't, you get pain or discomfort, or whatever it may be. So I think that's super interesting. But one thing that I think confuses me, so may well confuse a lot of people as well, is the actual like cannabis medicine. What is it in terms of? Obviously, you've got the plant, but there's different types. You can buy it over the counter, or you can prescribe it. There's the one that people smoke, recreationally. Is there a difference? What's the difference? I genuinely, because I don't actually know.
We'll try and break it down, if you like. So, cannabis is cannabis.
Yeah.
Cannabis sativa. That's sort of the name of the species.
The plant, right?
The plant. Yeah. Cannabis. Hemp is just a variety of that. But there's thousands of strains I've kind of mentioned. Now, if we kind of break it down into kind of those categories that you mentioned, if you think about the cannabis that people are smoking, largely that's been bred selectively over many years, decades, to be high in THC. THC is one of the cannabinoids, the active compounds in cannabis that makes people feel high and intoxicated. Has very little, if any, CBD in it. Sometimes it's referred to as skunk. And the cannabis that's sourced on the street, from the street market now, is much, much stronger than it was even 30, 40 years ago. So it's kind of a skewed product, if you like. It's been bred to make people feel high. And that's actually where a lot of the problems come from cannabis. So if you're young, you've got some risk factors for mental health conditions like schizophrenia. Say you've got a strong family history, or you're using excessive high THC smoked cannabis, you're more likely to run into problems with that type of product. And that's where some of the caution comes around with cannabis and kind of prescribing and checking for risks and so on. But high THC that's smoked in excess, particularly for young adolescents, more so in males and females, there is a theory like risks of mental health problems and psychosis and things like that. That risk is mitigated when you start introducing more of a balanced product that has CBD and other cannabinoids in it. So the products that are prescribed in the UK can also be broken down. There's a couple of licensed medicines that are produced by one particular company in the UK that have conditions that cover like epilepsy, treatment-resistant epilepsy, and spasticity and MS. They're called Epidiolex and Sativex. They've been through clinical trials. They've been approved as medicines. They're licensed. So in theory, they can be prescribed for named conditions. And they're produced as medicines. But by far, kind of, if you're going to access cannabis in the private sector and go to cannabis clinics, you're going to be prescribed an unlicensed medicine, which means it hasn't been through large clinical trials, but it's produced in companies under what's called EU GMP, which means they're good manufacturing practice. The MHRA, who regulate our medicines in the UK, then have to approve it for import and distribution and so on. So essentially, they are cannabis plants that have been either turned into oils that can be put under the tongue, or in some cases, the product's prescribed as a flower, dried flower, which looks like cannabis, it smells like cannabis, it is cannabis, that can be vaporized. The UK law doesn't allow the smoking of cannabis, but it allows it to be used in like a vaporized form. So that has to be prescribed by a specialist, and everything that we spoke about earlier, it's a controlled drug. It has lots of regulations around it. What's different between that and the street cannabis is often, well, you know exactly what's in it. You can see a certificate of analysis. You can check the levels of THC, of CBD, often the minor cannabinoids, CBN, CBG. There's all these other interesting things in the plant. The terpenes are really interesting. Terpenes are natural compounds that give cannabis its smell and its taste, and you can basically find a product that has a terpene profile as well that might suit a patient's needs. So like myrcene, for example, is really kind of has a sedating effect. So, you know, like what's nice about the products that are produced for medical use is you can see what, as a prescriber, you can see what's in them. You can see the ratios of CBD to THC.
I see what you're saying. You're essentially saying the different types of cannabinoids within the plant that have different effects.
Yeah.
It almost says like THC is has the negative connotations that most people associate cannabis to, but that's not the whole story. There's CBD.
There's all these others. And actually, THC is also really usseful medicinally. It's a good analgesia. It's good for pain relief. It helps with sleep. You know, I prescribe a lot of cannabis that contains THC, but we tend to introduce it slowly and titrate it up slowly, build it slowly. And if you put CBD in the mix, it actually counteracts some of those psychoactive effects. So you can sort of prevent side effects. The CBD products that are bought over the counter are derived from hemp. And so they're not sitting in a medical framework. They're actually, under the eyes of the regulators, are seen as novel foods. So they're regulated by the Food Standards Agency. What that means is you're not allowed as a company or a doctor to kind of put medical claims on these products. So you can't say on the packaging, this is going to help relieve your pain, for example. But CBD is CBD, whether it comes from a medical product, a street product that's kind of grown, you know, for recreational use, or it comes from hemp. It's like caffeine or something like that. It's CBD. It's
super interesting because I've always been, obviously being trained in the system we're trained in, right? I've always been kind of like, historically, if someone's asked me, like a family member or a friend about over-the-counter supplements for CBD, I've always said I'll stay away from them. It's nonsense, right? But now, obviously, having learned about it more, it seems like they can help with certain things. But how? I'm guessing the dosage is much smaller than the prescription dose. Is that correct?
That's true.
Yeah.
So for some reason, I think it was 70 milligrams a day. The Food Standards Agency. There was this arbitrary number that was just
7.
almost made up to say like don't exceed this dose
Of what is that? Of THC?
of CBD.
Of CBD.
The wellness products that you can buy over the counter. Yeah. But the reality is, like, kids with epilepsy might be on thousands of milligrams of CBD a day.
Wow. But is there a limit? Like, what is it? Like,
not really. I mean,
what's the dose? Like, you titrate up, like you said, right? So
CBD, most people would need somewhere between 10 minimum, 10 to maybe 100, 200, 300 milligrams a day of CBD to get a therapeutic effect. It's been looked at by the World Health Organization, CBD on its own, and it has no addictive properties, no psychoactive properties. It's deemed safe. The problem is some of the CBD products are not that well regulated. So unless you can see like a certificate of analysis, it's exactly what's in a product, you need to kind of be a bit careful what you're buying. Some of them are better than others. And if I was going to give our listeners like one tip, it's just to say, check for a certificate of analysis so you can see exactly kind of the breakdown of what's in the product. They shouldn't have any controlled substances in them. And actually there have been some studies, certainly a few years ago, I don't know if it's the case now, I think the market's kind of cleaned itself up a bit, but where common products were tested off the shelf, and some of them had controlled cannabinoids in them. And there's like 12 or 13 controlled cannabinoids, more than THC, there's a few others. And they were found to have kind of components in them that essentially are not legal. That's improved over the years. There's been tighter regulations, but the regulations are catching up. But there's been some times over the last few years where, you know, lots of products have sort of flooded the marketplace. And CBD's been added into vape carts, you know, for e-cigarettes and other things like that. You can buy it in the supermarket now in drinks, and so, you know, it's as a compound, it definitely has therapeutic benefits. Strongest evidence is in epilepsy and as an anticonvulsant, but it's also a good anxiolytic. CBD can help with anxiety and pain and inflammation and sleep.
Yeah.
But there's loads of receptors, so over 65 molecular targets for CBD. We don't fully understand how it works.
Because anecdotally, I've had lots of patients coming in asking, probably more so than anything, about CBD.
Yeah.
And it's always been one of those things I said, well, you know, if it's working for you, I've never really known what to say. But more and more, like I'm thinking, like, you know, if it generally is very safe to take, especially the doses you've mentioned over the counter.
Yeah.
And the analysis thing is it's not just for, you know, CBD products, even for like any nutritional supplement. You know, a lot of these don't have, you know, certificate when they should really do, because you don't actually know, are you getting the full dose of magnesium they're saying, kind of thing, you know, for magnesium supplement. But what's interesting, I think, you know, with pain, sleep, anxiety, lots of patients have come saying, look, this particular, you know, oil or tablet, whatever it is helping with their symptom. I've always been reluctant, but now it's almost like, well, I don't see why we should be kind of not having a conversation with patients, especially if especially, you know, now we know that it actually works and there is a whole system behind it.
100%.
And I think that piece of information for doctors in particular around the whole system behind it, I think once you have that understanding, you know, that underpins everything. Because without that, it just seems a bit snake oily. But even you just speaking to me now, it doesn't, you know, if patients ask me about it, I say, look, if you're having the doses over the counter and it's helping, you know, carry on taking it. There's no reason why you shouldn't.
Well, I'll give you a striking figure. It's been quoted many times in the cannabis press, but there are an estimated 1.8 million people in the UK. There was a big survey, a YouGov survey a few years ago. They found that around 1.8 million people in the UK use cannabis for some medical purpose. Right. So even from a harm reduction point of view, wouldn't it not be better to get those patients in a legal framework and give them oversight of what they're actually taking, rather than leave them on the street and at the mercy of, you know, dealers and whatever to be sourcing cannabis. So, so like there's a huge number of people that are using cannabis because they've not found conventional medicines or conventional pathways to be of any benefit to them, or of limited benefit. So, and then, I mean, the total number of people that use cannabis is obviously much greater than that, but there's a large percentage. Think about people as well who are perhaps elderly or end of life care. I mean, I know personally friends who have sourced cannabis for elderly relatives who are receiving like palliative care, end of life care, just to see if it helps a bit with their pain or their sleep and so on. I mean, that's not a great place to be, is it? When there's a legal framework that you could potentially put these patients under and manage them. Interestingly as well, if you look at the data from established markets like the US and Germany and so on, you'll often find that the right type of medical cannabis prescription will sometimes lead to patients coming off their other medicines. So there's some really interesting papers that look at opioid receptors in cannabis, and they find that patients have a much lower need for opioids, and they can often get off the opioids. I mean, the clinic that I work within, and the prescriptions that I've seen patients come off benzodiazepines, gabapentinoids, opioids. They're almost off everything, but they stay on the medical cannabis because they feel it helps the most.
I suppose it's great because I think, especially with the benzos, right? Like, I think they're overused and people get, you know, stuck on them and they can't live without. And then if the GP says no, they end up buying them on the street, which is crazy, right? But how powerful are prescription cannabinoids in comparison to endogenous ones we produce? Are they similar? Because I suppose the question is, the second sort of nuanced part to that is, can you develop a tolerance to these like you could to medication?
You can. It's a good question. I mean, I've had conversations over the years with doctors and perhaps people taking a more cautionary approach, say, oh, this could be the new like oxycodone or the new like thalidomide and things like that. But we're talking about something that's been used for 10,000 plus years, right? So we actually do have a lot of data on it. It just might not look like pharmaceutical data, but we've got historical data, anecdotal data over millennia that says actually you can't overdose on it. You can't kill someone on it. Most of the studies that have looked at addiction and tolerance and dependency are skewed because of what I said earlier. That largely like this is sitting in the recreational space and it's being smoked with tobacco and other things, right? But there is a risk of tolerance. We do sometimes see it with patients that have been on a script for a long time, and often all it needs is either what we do sometimes a little drug holiday, like where you have a week or two off, and you go back, the receptors reset themselves, or you swap strain, you get a slightly different strain or kind of chemovar profile with different terpenes and things like that. But it's generally like, and I don't want to kind of say it's a wonder drug because it isn't. You know, I think personally the ideal situation for anyone is not to be on anything. Like, that's the ideal, isn't it? You don't need to be prescribed anything. But for some people, it is remarkable, and it definitely allows them to kind of wean themselves off some other medicines. And I find generally the patients that I see, the side effects are minimal, if any, and they're better. It's better tolerated often than those other medicines that we mentioned that are commonly prescribed for pain and sleep and other things like that.
Yeah, you know, I think just truthfully speaking, when I prescribe these medications sometimes for patients, you know, I sometimes think these are medications I wouldn't want to take myself, but there's sometimes no better option, in particular, you know, the pain meds or even some mental health medication. So, and I think with cannabis and CBD, it's almost seen as it is a more, almost a natural, you know, medication that kind of links in with your natural system. But is there a risk of, if we give someone CBD or prescribe CBD, is there a risk of their natural endogenous system shutting down or producing less cannabinoids because of you having exogenous? Because, you know, I would have thought it's a bit like hormones, right? If you give someone a lot of exogenous hormone, does it reduce their endogenous amount?
I don't know is the answer. I think I see it as sort of topping them up a little bit, and it kind of just rebalances the system. It kind of goes back to our earlier conversation that the science is still, the questions are still out there about the endocannabinoids and the endogenous underlying endocannabinoid tone, and you know what's a normal level, what's maybe low. We don't know, and a lot of it's kind of just theory and speculation. But I think like what drives me is seeing the patients improve and the benefits of, you know, the overall quality of life. So I remember speaking to someone who's done a lot of research in cannabis, been involved in a lot of clinical trials, and what this chap said to me that I remember is, if you're looking with what's interesting with medical cannabis on prescription is, if you're just tracking one outcome, you might not see a significant difference, right? So if you're just tracking a pain score, okay, my pain was 9 out of 10 before medical cannabis, and now I'm 6 months into treatment and it's 8 out of 10 or it's 7 out of 10, that might not look significant. But when you start to put in other metrics, like what's your sleep like, what's your relationship like at home with your partner or your family, are you back in work, like how would you rate your mood? When you start looking at all those other things, that's when you start to see big improvements often. So look, I'm not saying it's complex. Medicine's complex, people are complex, but I think sometimes as prescribers and clinicians you can reach the end of the road with some patients when you've gone around the houses, you know, you've tried to get them to a pain clinic but they're waiting a year to be seen, so you give them more opioids or you give them more gabapentinoids and medicines like that, like amitriptyline, and then they go to the pain clinic and they'll get a joint injection or they'll be referred for some CBT and other things. It just doesn't, or the outcomes are just sometimes not great for these sort of patients. So to have something else in the toolbox like medical cannabis, I think is really great. It can really help. So
yeah, I mean, I agree. I mean, I want to just touch, massively. And one of the things I think, just for me, almost some validation from you, someone who's prescribed it. Well, I've never actually prescribed it, but someone who's prescribed it, as a job. Have you actually seen it work in particular for fibromyalgia?
Oh yeah,
you have.
Yeah.
Good, because
really
how does it work? Because that's one condition I see most people suffering with, among many. But yeah, can you talk a bit about how drastic the effect can be, and
Well, it varies. I mean, everyone's kind of unique, as we know. But I've seen a lot of patients over the years who have improved significantly with fibromyalgia and medical cannabis. Fibromyalgia, it's one of those very kind of difficult to treat conditions. There's often a strong interplay between physical symptoms of pain, but it's often also kind of associated with chronic fatigue, brain fog, tiredness, kind of general malaise, and that in turn might affect someone's mood. So, like, often patients with fibromyalgia suffering with anxiety or depression, or they're struggling to keep up with their home life or their work and so on. So, it can be a devastating diagnosis for some patients because, like, it affects more than just pain, right? It affects kind of often the overall quality of life for these patients, and the treatment options are limited. So the classic pathway that I see, the patient first presents to their GP. There might be a question at that point of fibromyalgia. Then they might be referred to a pain clinic or a rheumatologist. Rheumatologist does a load of blood tests and says, "Oh, you've not got rheumatoid arthritis. You've not got autoimmune, not got XYZ. So what can we do? We'll refer you to like a fibromyalgia program, or
if there is one,
pain management, if there is one in their area.
Yeah.
So they wait another 6 months or a year they're seen, and then it's some talking therapies or pain management and so on. But fundamentally, they're often still suffering. In the meantime, they might have been prescribed amitriptyline or duloxetine. Again, some patients might benefit, others perhaps won't. So what are they supposed to do, some of these people, right? They feel often they're poorly understood. The symptoms they might not be taken seriously in some cases by people around them and so on. So this is where I think we need to think outside the box a bit as doctors, and actually, medical cannabis, often in oil form, is really effective. It helps a bit with sleep and pain and mood, and kind of has that subtle effect on things. Prescribe a lot of flower for patients to vaporize fibromyalgia. And it can help, along with all the other things that we know: good nutrition, graded exercise, meditation, breathing, breath work. There's loads of other things that can help, and I just think medical cannabis can be part of that picture, and part of that formulary of options that might help. So that's why it's such a shame it's kind of not accessible in the NHS, and it's not widely accepted. I mean, NICE, who provide us with guidelines within the NHS on prescribing, have said there's no role for medical cannabis in the treatment of chronic pain. Whereas there's thousands of papers, scientific papers, that show it's actually really effective. The Americans have kind of made their own conclusions up about it. So we've got this kind of dichotomy of like one person saying one thing, another person saying the other thing, whereas right in the middle of it is a patient that might be suffering who can actually access a treatment that is legal, it's safe, it's well tolerated, but they're kind of missing out because it's not available in the NHS. It's not kind of endorsed by the regulators for those particular things. So yeah, definitely fibromyalgia is.
Yeah, I mean, I touch on fibromyalgia because it's, and I guess you can link that with ME, because it's one of those things that as a doctor you almost dread for the patient to come in when you see them on your list, right? Because you think, what am I going to be able to do? 10, 15 minutes. And one thing that I have been looking at a lot is medical cannabis, and it's a shame, that it's not available on the NHS. And I, to be honest, I don't think it's going to be available anytime soon for a GP, to be able to prescribe. But what kind of things do people come in that you've seen? What kind of conditions does cannabis help with?
So by far the most common conditions that are being prescribed for in the UK are pain conditions, usually a chronic form of pain, like long-term pain, lots of fibromyalgia. I've seen a lot of like connective tissue, like Ehlers-Danlos, things like that, right? People do really well often with medical cannabis who suffer with that. There's a strong link with like fibro and mobility and connective tissues disorders and things like that. Seen a lot of that. Chronic pain, fibromyalgia, chronic fatigue. Long COVID's quite a good one. Lots of patients kind of been accessing the clinics for that reason. And then lots and lots of mental health disorders. So probably got an equal number of, or possibly more, psychiatrists than any other specialty working in this field, and pain consultants. They're probably the two biggest groups. So psychiatrists often prescribing for anxiety, insomnia, PTSD, and then conditions like those are probably the main ones. And then you've got the sort of neurological, more specialist things like neurological conditions like epilepsy, Parkinson's, agitation in dementia, some of the things that might be associated with autism, like anxiety and behavioral issues and things like that. So kind of case specific, but I'd say by far and large, the most of the conditions that are being prescribed for are either a form of chronic pain or a common kind of mental health condition, like anxiety or.
What about ADHD/autism?
Yeah, I've seen a lot of patients do quite well with medical cannabis. Obviously, with autism, you're treating the symptom of the autism, right? So and the anxiety that can manifest from autism is slightly different to like a primary diagnosis of autism in like a neurotypical person. It's a slightly different form of anxiety or behavioral change if you have an underlying diagnosis of autism. There's quite a few studies that have been done in adolescents who are suffering with some of the behavioral challenges around autism, whether it's like anxiety or behavioral disturbances, insomnia, who have responded really well to medical cannabis. But obviously that's kind of quite a niche area. But personally, I have seen and treated like patients who have some of those diagnoses in the background who are responding well to medical cannabis.
I think as ADHD, and autism, another one of those conditions where if you get diagnosed with it, the treatment is not very nice, the medication, and so it's interesting that you say that because again, it's another thing that people kind of, ask about. Another one that I've heard a lot of people asking about, and I don't know if it's restless legs. I don't know whether I don't know what, because again, it can be, so people think, it's just your leg moving, but this can be like really serious. Like people can't sleep, it can cause, and that can lead to the anxiety, depression. And it's like a really nasty condition where, again, the medication we use to help with that is not very nice. And it doesn't always work.
We use for that. We use a dope...
like Ropinirole or something. Yeah. So, which is dopamine agonist. So,
that's quite a nasty
it's not
drug.
It's not very nice. So it's almost left to a very last resort. And even then, it's not that effective at times. Yeah. But is there any evidence of it working? Or have you seen it working?
I've seen it, restless legs, yeah. I've seen some patients with that in their diagnosis. Yeah.
Because theoretically, it, going back to the system, it always makes sense, right? If restless legs is down to an overactive, system, if they are deficient, then this would, topping them up would almost settle them down and help with the restless legs.
It's definitely worth trying.
Yeah.
But going back to the kind of ASD or autism, one thing about cannabis, right, especially when you start prescribing it, is a very bespoke treatment. It's like very personalized. So someone might find that a particular strain isn't working for them or a particular format. The main ways it's prescribed in the UK are sublingual oils, drop under the tongue, flour to be vaporized. There's some capsules and that are coming to market and maybe transdermal, but they're not commonly used at the moment. So it's mainly an oil or a flour. But I saw someone recently who took him a while to find it. He's ASD, ADHD, and has found 2 flower strains that really work for him. It's like life changing. He said, I can focus my thoughts, I can get on with my day, I can work. People around him don't recognize him. He's so high functioning, tolerates it incredibly well. He's come off I think he's come off the stimulant meds as well, or very much minimized those. Because as you say, they're not very well tolerated, and they're probably more risky to prescribe than cannabis. I'm more cautious around that type of medication than I am with medical cannabis.
Yeah. So what kind of, so say that example there, how does it normally work? So someone comes in, I'm guessing you give is it like almost like a pathway, you give like a generic version or a generic strain, is it? Or first line?
Try. So because the plant and the products are complex, there's like hundreds of active cannabinoids and terpenes and flavonoids, there's all these things in it. Make it simple for ourselves. So generally, think of it in 3 groups: high THC product, balanced product, which is like a 1-to-1 ratio of THC to CBD, and a high CBD product. So a typical combination might be to start someone on it depends, it's very case specific, but say commonly I might put someone on a high THC oil for nighttime that you titrate up very slowly. So it might be like a 20-to-1 ratio of THC to CBD. But you're starting at tiny amounts and you're slowly building up. So that might help with sleep and pain overnight. Especially it's good for, insomnia or conditions with like fibro where patients might find their pains disturb their sleep. Daytime, because of the sedative effects of THC, you might want to put someone on a high CBD or a balanced oil. Again, build it up very slowly. If it's not working, you think about introducing flour. So the oils often work kind of long acting as a sort of baseline background medication that you can build up slowly, but the flour might be really helpful for like breakthrough pain or breakthrough anxiety, like shorter acting but a quicker effect. There's new products coming to market in the forms of like vape pens and things where you could have a bit more of a meter dose, which is going to be quite useful. So it was still fairly crude the way we prescribe, but I think as the companies kind of invest more in research and delivery methods, like we'll get much kind of more targeted treatments and meter treatments and things like that. It's quite a kind of loose way of prescribing, and I'm very much directed by the patients as well. I kind of say to them, like, you can slowly titrate it up. If you notice any side effects, just come down. Common side effects might be things like dry mouth. What else do you get? So a bit of over sedation, or they might feel a bit groggy in the mornings. It's probably worth mentioning some of the kind of parameters around that. So like anyone who's had like unstable heart disease, like a recent heart attack or stroke, you really kind of want to avoid THC containing, because that can increase the heart rate a little bit. But there are very few, like we wouldn't prescribe for anyone pregnant or breastfeeding. Ages can obviously be an issue as well, but and any kind of risk of psychosis or first degree relative, very strong family history, you definitely want to avoid THC containing products.
And are these kind of lifelong treatments, or can patients go in for like a couple of 6 months and almost titrate off to see if or is it kind of something they stay on forever?
I think it's case specific. A lot of people I think find it works so well they don't want to come off it. But it's kind of trial and error really. I sometimes say to people, you can try a few months off and see if things return to how they were, or but what it kind of allows sometimes is for patients to focus on other aspects of their life, so they can get fit again, or they can get back to healthy eating or weight loss and good sleep and so on, and maybe kind of come down a little bit on the medication. But in some cases you do end up with patients that just want to be on it long term because they find it helps them so much.
I suppose one thing is just probably again maybe a naive question, but it's one that a lot of patients may ask is the risk of psychosis or schizophrenia, because you hear that a lot. People that smoke it recreationally are at high risk of getting these kind of things. But with the medicinal cannabis prescribed, what's the chance of that happening long term?
There's not a lot of cases out there in the medical space. So if you prescribe a high THC, unopposed THC with no other cannabinoids in the mix, you're going to push people in that direction. But the data that I've seen shows that actually, like under a kind of medical umbrella, that risk can be mitigated. And as I said earlier, like anyone with a history of psychosis or very strong family history of bipolar, mania, schizophrenia, that sort of thing. Traditionally, you would say like you wouldn't prescribe for them, but I've actually come across quite a few psychiatrists that do prescribe for them, but they prescribe high CBD products, right? So like CBD actually can counteract some of those psychoactive effects. So psychiatrists are becoming more interested in that because they know a lot of people. I mean, presumably, have you worked in psych wards?
I have before, yeah.
Did you come across patients that would like go on leave from the ward, smoke a joint, and then come back floridly psychotic?
Yeah.
Have you seen it? Is that right? Yeah. So like I've seen loads of people like that over the years. Yeah. So that's, again, you kind of create that negative
connotation with it.
But if they were being prescribed, they enjoy cannabis or they find some benefit from it, they were being prescribed a product that was had far less THC in it and lots more CBD, you might not see that effect. You might find that actually they're like, that risk is offset by all these other good things in the mix. So like, I've come across psychiatrists who are like, who prescribe for patients who do have that in their history. They're doing quite well from it.
Yeah, and it's interesting because yeah, I would, yeah, that's interesting you said that, because I would have thought a lot of people were scared of getting it long term. But, looking at the data, like I said, if there's a very low risk of it, or any risk of it happening.
I know even with the studies that are slightly skewed because they've looked at cannabis with tobacco, you find it's less addictive as a drug. If you just look at cannabis, even forget medical cannabis, just cannabis on its own, less addictive than alcohol, opioids, like lots of other things that people are using out there. But that opens up a whole nother conversation on like adult use. Should it be legalized? Should it not be legalized? That sits slightly outside the medical framework, but it's a good question to ask.
It's an interesting, but yeah, maybe one for another day, because be hours of discussion, but it's an interesting one because, I won't get to it now, but I'm tempted to. But one thing I've saw, when I was looking into this was around, or something that's been massive recently, is around weight loss and obesity. So, with the, I'm obviously thinking about Ozempic, Wegovy, all these kind of injections that are obviously the hot thing right now. But I'm not sure if you saw, but I remember I saw a paper, looking at some research around how medicinal cannabis can help with obesity by somehow suppressing appetite. Is that something you've seen, or is that something you're aware of?
Because across it a little bit around weight and it's. I think a lot of it is still theory. Okay, there have been a couple of interesting medicines that have come to market. One of them was something that blocked CB1 receptors, Ribalant or something like that. There's been a couple, but they were pulled off the market. They good effects for weight loss, and I think they lowered lipids and other things like that. But the side effects were, because they were just blocking these one receptors, there were lots of psychiatric side effects around that. I think what we do know, and what there is good evidence for, is that the endocannabinoid system is heavily involved in metabolism and hunger, our sense of hunger and things like that. So I'm sure in time there'll be kind of drugs that are looking at that, or kind of looking at correlations. Interestingly, people that, I think, cultures that have high cannabis use, like Rastafarian community and places around the world, people are quite lean. They're not particularly overweight.
It's interesting.
I don't know. I'm kind of thinking out loud a bit here, but I think there is some interesting data out there on that. But there's another interesting area around the gut and a colleague of mine who's kind of more of a biochemist, he wrote a paper recently about omega-6 and omega-3 and how that can influence the endocannabinoid system. So like traditionally as kind of hunter-gatherers and throughout our rich kind of evolutionary history, we would often have a good balance between omega-6 and omega-3, these kind of fatty acids that we consume in our foods, right? But the Western diet has pushed things much more heavily into the omega-6 category. So we're consuming a lot more vegetable oils and soya and protein and things like that. We're perhaps consuming less omega-3, like, Mediterranean diet. And there's a strong link between the gut microbiome and the kind of endocannabinoid system and gut health, and, and that is playing a part in obesity, or kind of driving some of these phenomenon that we see where people are kind of perhaps putting on weight more so than you would think they would. So yeah, it's complicated, but I think probably it's an area that's ripe for research, and that we might see some new kind of drugs coming to the market in time, or new kind of approaches to that, utilizing the endocannabinoid system to kind of modulate. I mean, we know cannabis, we know THC, it makes people hungry.
That would literally come on. I was thinking, so this is kind of, after that question, thinking a lot of people say they get known as munchies after they smoke cannabis. That's just a THC
That's
thing.
That's a THC in the brain. And what it does, I think it works in a number of ways. It helps, it makes a sense of taste and smell more acute. So you can kind of smell and taste the food in a richer way. So it kind of heightens the sense of smell and taste. It activates ghrelin, which is it's a hypothalamus, isn't it? I think that produces that. It's kind of our sense of hunger. So yeah, it hits the olfactory centers. It does that. There's something else it does. It's passed me by now. But yeah, I mean, it has. It does. We know it directly interacts with our hunger receptors and makes people more hungry.
Yeah, and it's interesting. But one thing I guess is, applicable to me.
Dopamine. It kind of increases our reward system as well. We want
more of it. Yeah. I guess that one thing is around concentration and focus, because I think somebody doing like this or their focus work, a lot of people say it gives them clarity and allows them to focus. Is that a CBD thing? Is that because a lot of it, but this is specific to supplements people buy over the counter. They say it helps, as almost like a recreational thing, just to help with them focus. And I've been interested in it. I'm not dabbled in it, but I've been interested to see, look, is it something that helps you focus? That's something I struggle with sometimes. I find it hard to focus on one thing. So, it's. Has anyone ever? Have you seen it? People using it for that, just literally just for focus and sitting down.
I've seen people report, like the case I spoke to you earlier about clarity of thought, focus, but that's largely with a product that's coming from the whole plant. So we don't know what it is. It's probably the combination. In fact, there's this phenomenon that we've not talked about called, again, it's kind of up for discussion in the scientific community. It's called the entourage effect. And what that theorizes is that cannabis that comes from the whole plant that contains all these hundreds of active cannabinoids is much better. The therapeutic effect is much better than a single compound on its own. So I suspect if you gave someone just CBD, but then you gave them this kind of rich brew of cannabis that has all these other minor cannabinoids and THC and everything else, you'll see a much stronger effect because they're all working in synergy. It's called the entourage effect.
So what you're saying is, so with certain conditions, I'm guessing the strains are there, and obviously certain strains help with certain conditions. Is that correct? Or is that not? Is that a simplified version of it? Because would it not be worthwhile just giving
the case?
Is it?
Yeah, if you go on patient forums, I mean, it's insane how much knowledge some people have on cannabis, and I really kind of respect and admire the kind of knowledge within the cannabis communities. So there are patients that I've met and groups I'm aware of who have extensive knowledge of the plant. They understand the genetics, the strains, the chemovars, the the chemical constituents, the history, the sort of, and there's a lot of conversations that go on in Reddit groups and other mediums that basically will say like, this strain is really effective for me, or I kind of recommend that for that condition. So I think as doctors we can actually learn like a lot from from some of our patients, or from people that actually have experience of the plant and they understand it and they understand how it works. Yeah, it's really interesting.
But going back to the whole plant being all those rich compounds in it, is that a good viable option? Does that exist as a medicine? Like,
oh no, that's what we're prescribing.
Or is it like literally just the whole
we're
plant?
Not prescribing isolates.
Yeah, the whole thing.
It's like that, and that's why. So, trying to join the dots up. The reason we don't have like widespread kind of access and NHS funding, lots of kind of endorsements by the Royal Colleges, etc., is because they'll often say we don't have enough evidence that this works as a medicine because we've not seen it run through a clinical trial like we would with a conventional medicine. So a randomized controlled trial, that's basically what they're saying, like a placebo and the drug, and then you see the outcome. You can't really do that with a botanical product. You can't say, if it's got hundreds of constituents and every time you prescribe it, it might be slightly different to the previous crop or the previous you can't standardize it and run it through a sort of pharmaceutical style treatment. So you have to start looking at observational data, longitudinal data, different types of data and endpoints. So that's why it's hard to kind of group it into the same category as, say, gabapentin, or these medicines have been through like very kind of stringent clinical trials. You can't really do that with a botanical product that comes from the whole plant. And actually, like I said before, like if you just isolate those individual compounds, you probably find the effects aren't, the outcomes aren't as good as if you prescribe the whole product, where you've got this synergy and this kind of entourage effect. I think we'll probably see some companies looking more at the like synthetic cannabinoids, like synthesizing some of those compounds. There's also really super interesting work being done on the precursor, the acidic precursors. So the plant, when the plant is kind of freshly cut or it's alive and in the ground, the cannabinoids exist as these acidic precursors and they're really powerful, like the anti-inflammatory effects, anxiolytic, but they degrade very quickly and they become unstable. So CBA then turns, I think, into CBDA becomes CBD or CBG. Can't fully remember the pathways, but these acidic precursors are like really interesting as medicines because they're so they're so kind of powerful in their effects. So there are some companies looking at those, but they're very unstable. But I think over time, we'll see synthetic cannabinoids, we'll see new drug delivery systems where you can like really kind of, target. You can really kind of maximize the way the body kind of absorbs the products and so on, and metered dosing, and it will become a bit more medicalized, sophisticated. But it may always sit slightly outside of conventional medicines in its own kind of subspace, just because it comes from a whole plant.
Yeah, and so I mean, obviously, so what can someone do? Say they've, for argument's sake, if we've got fibromyalgia, they're wits end, they've tried every single CBT therapy, every single kind of, benzo, gabapentin, whatever it might be, physio, but they want to try CBD. What are the options for them in the UK? What can they do?
For CBD, they can buy it over the counter, but just ensure that it's kind of coming from a reputable company and check that it's got a certificate of analysis. We've actually created a document. I can signpost it to you, but the group that I run, the Medical Cannabis Clinicians Society, we created a CBD guide for clinicians actually, but I think it can be downloaded by anyone. It just kind of outlines what you should look for in a product. And it's quite comprehensive. It kind of gives you a checklist, things to look for. So
what is that checklist? Yeah, because
I'll give you a list of it. It's like, check like for things like expiry dates, certificate of analysis, milligrams per mil. Some of these products, like we'll talk about 1,000 milligrams of CBD or 1,000. The units sometimes don't correlate or don't add up. What you need to know as a consumer is how many milligrams of CBD am I consuming per mil or per point mil in a syringe, right?
So they can,
So you know what you're consuming. Some of the products are not very clear in the way they do that.
In terms of the dosage, so going back to the milligrams per mil, say if it wasn't like say argument like 70 milligrams per mil, and it was say they had one sachet, say, or one gummy of 70 milligrams, would that be adequate? So 70 milligrams, how would they figure that out on the packaging? Because sometimes it doesn't say anything like that.
It wouldn't say, because again, they can't promote these as medicine. Or they have to be a bit careful. But we outline this in our guidance, but you'd probably want to start like 10 to 20 milligrams a day and then just slowly build up from there. But by all means, I mean, if you get a good product, CBD product can help with all kinds of things.
Okay, so certificate of analysis, reputable company, expiry date, check how much CBD you're actually getting.
Per mil. Those are probably the main parameters. Are there any others I'm missing here?
What about formulation? What as in form? Is it a powder better? Is it a cap?
Probably go for a sublingual oil. And then you've got the kind of different. You probably want to go for a broad spectrum oil. So full spectrum, in theory, might have some controlled cannabinoids, but in very tiny amounts, like THC and THCV. There's CBN, I think, is controlled, but the products that come from the whole plant, but they've removed the controlled cannabinoids.
I see.
So a full spectrum, and then you might get an isolate product. The isolate is just CBD on its own. It doesn't have the minor cannabinoids.
But the full spectrum is
will have a bit of everything in it.
Probably
from
the best one.
Comes from hemp. So probably a full spectrum oil from a reputable company with all those things in place. Why not give it a go? I mean, if it works,
And what's the onset of action? Because it works quite quickly, doesn't it? Cannabinoids. I've heard that the effect is quite quick. Something like, is it like?
I'd say the opposite.
Is it?
I'd say with CBD products, a lot of people that take them especially over the counter products, might take a while for them to notice. Some people might say, "Oh, it didn't work for me," or someone say, "Actually, I think it might be helping." I've kind of been on it a few days or a few weeks and slowly built it up. So the onset is usually quite subtle and slow. but they're not going to get lots of CBD from an over-the-counter product. Generally, it's quite a low dose.
So then, okay. So then, what's the next? Currently in the UK, what's the other option? Say they've tried, they've tried something for say 2-3 months over the counter. If they want to think about having a prescription for it. What are the current options they can? Because
unfortunately,
is the NHS any good or is
no? Unfortunately, it's private route, so they're going to have to pay for it. A simple Google search you'll find cannabis clinics. Some are cheaper than others. Most patients are probably paying around somewhere between 150 to maybe £200 a month for their medicines. Plus, then you have to factor in the follow-ups and the doctor follow-ups or pharmacy follow-ups. So there is a cost to it. But some people out there inevitably will be buying cannabis in the street market, and they might be spending a similar amount on an illegal product. So it might be a nice option for some people who are already consuming cannabis, or for those that can afford that route. Then you can go into a clinic and basically be prescribed. The criteria usually is that someone has to have tried 2 licensed treatments.
I see.
But most doctors and prescribers are quite open-minded about that. So it doesn't necessarily have to be like, I've tried. Some people just might not want to go on an opioid, but they might have tried, for a pain, they may have tried some paracetamol, ibuprofen, cocodamol. I don't know. I mean, that is an opioid, but they may have tried a few things over the counter and some physio, and that could be enough.
I see what you're saying.
Or they've tried, for anxiety, they've tried some meditation and maybe an SSRI or something. But most prescribers like to have seen that a couple of things have been tried first, and then they might be open to that.
Okay, and if someone wants to see you specifically, where can they, see you? Are you online?
For me particularly. So I currently work for a clinic called London Resilience Clinic. We're not a cannabis clinic per se, but we do prescribe quite a lot of medical cannabis. But we're kind of more in the functional integrated medicine space. So looking the whole person, the kind of holistic pathways. So alongside medical cannabis, we do functional medicine testing. We're looking at gut health and kind of work with therapists and nutritionists and those sort of things. So that's where I currently do clinical work. But that's the kind of medicine that I like to work in, that sort of space, looking at the whole person, how they're functioning, and using medical cannabis as one tool out of many other things that we do. So that's all right. But if you're just solely interested in medical cannabis, then again, there's like lots of clinics out there if you just kind of Google those.
Okay. And just one last thing, it's been, so interesting, fascinating, but where do you think the future of this lies in terms of cannabis as a medicine? Because I know, before you came on, I said I saw you on a podcast back in 2019.
Oh, yeah.
And I said, I didn't pay too much attention to that because I thought, lots has probably changed. And then you kind of said, actually, not much has changed kind of since. So 5-6 years. So where do you kind of see it in the next kind of 5 years? Are we still going to be the same? Is it going to be the same conversation?
Okay, a little bit's changed. Yeah. We've probably got about 50,000 patients in the UK who are accessing medical cannabis through private clinics. That number's growing year on year. If we were to follow suit, if we follow Germany or Australia, who legalized at a similar time to us, we'll probably find in 5 years' time we've got a few 100,000 patients being prescribed medical cannabis. So that's a good thing. It's certainly not going away. I predict that within a few years, most people will know someone who's either being prescribed it or they're interested in being prescribed it. Because I'll tell you one thing, this topic definitely kind of is not confined to like young people. It's elderly patients. I mean, I think the oldest person I've been prescribed for is 89.
Wow.
Yeah, like it's, people get to a stage in their life where they need something, or they or they're not responding well to other treatments. So it's not age specific, and it's not, it's a universal medicine. So yeah, I think we'll find it is discussed more and more. I think the stigma will just continue to fall away. Like if you were in Canada now or elsewhere, like you wouldn't necessarily have that kind of negative connotation around it, because you'd know people that might be using it and benefiting from it. So I think we'll find more doctors hopefully talking about it, hopefully more training in the medical schools, more patients being prescribed for it.
Mm.
I think the key things that we need to kind of address here in the UK is GP prescribing, initiating prescribing, and also NHS funding, particularly for children with epilepsy. Because at the moment, these families are having to fork out thousands of pounds a year to kind of find treatment through the private clinics. So yeah, I'd like to see in maybe 5 years' time, wider access, more accepted as a medicine, more prescribers, and perhaps, it's wishful thinking, but some NHS funding. I think there's massive cost savings as well, actually, with things like hospital admissions, de-prescribing. But, you know, things are slow in that when it comes to government legislation and things like that, it's not a quick process. But yeah, there's no reason why we can't kind of follow some of the trends that we've seen in similar countries, like I'd say the most similar are Germany and Australia, where the market's really opened up.
Yeah, I mean, I hope it goes that way. And just from a GP point of view, if we can prescribe it, it'd be so much easier, you know.
Yeah,
because
totally.
we see patients at the front door, you know, and if we can try it before referring them, or the patient having to go private,
give it a go. Exactly.
Yeah. Well, look, thank you so much. I've learned. It's always been like a teaching session for me, you know. But thank you so much, and you know, maybe have you on again in the future if there's any more development. But
absolutely.
Thank you.
Thank you, Asim. Thanks.
Done. That was an awesome episode, man.
Was that all right?
Hour and a half. No, it was awesome.
Hour and a half.